So we've been saying that we have cardiac diseases and we have acquired and we have got congenital heart disease. And we did say that we've got two types there, cyanotic and acyanotic. So we did talk about the diseases that affect the coronary in the first video, and then we spoke about the diseases that affect the pericardium. Now we're going to be talking about the conditions that affect the myocardium, right? So if you haven't watched the first video, please make sure that you go and watch that video. We said the conditions that affect the coronary vessels is those conditions are collectively called ischemic heart disease, and we know that you can get acute coronary syndrome and you get a stable angina on this side, right? Then here you get your two types of MI, STEMI and non-STEMI, and unstable angina this side. Stable angina, STEMI, non-STEMI, and STEMI. That's that side. Then when you come to the pericardium, quickly, you've got your infectious causes, and you have non-infectious causes. We've spoken about the viruses, different viruses that can cause pericarditis. We've spoken about the bacteria. We've spoken about the fungi. We've spoken about the parasites that can give you pericarditis, infectious pericarditis. Then you've got non-infectious causes. We've spoken about the autoimmune disease and the non-autoimmune disease. Under autoimmune, you've got things like SLE, rheumatoid arthritis, scleroderma. That's autoimmune. And then under non-autoimmune, you've got things like malignancy, and we said it's usually metastasis from the lungs, from the breast, even from the prostate, even from the bone can get. That's malignancy. And then we can have now things like not necessarily diseases, but you can have trauma as one of the conditions that affect the pericardium, blunt or traumatic. And also, very important, idiopathic causes. Idiopathic causes are the most common actually, compared to the others. Now, let's talk about the myocardium. So, talking about the myocardium in this segment. Acquired, congenital, then talking about the myocardium. This is the workhorse of the heart. This is the part that actually that does the actual pumping of the blood, the myocardium. The myocardium, the diseases that affect the myocardium are okay, let me put it this way. So the diseases that affect the myocardium, they end up affecting the functionality of the heart. So these diseases are called cardiomyopathies. And cardiomyopathies, they affect both the structure and the function of the ventricles, right? So cardiomyopathies, they make the structure of the heart to be abnormal, and they also affect the function. And cardiomyopathies are intrinsic myocardial diseases. So, or I can say they primarily affect the myocardium. I hope you guys get what I'm trying to say. So for a disease to be labeled as a cardiomyopathy, it must be intrinsic to the myocardium. If you get some kind of ventricular failure because of hypertension, if we are strict in our defining of terms or definition of terms, if you get abnormalities of the myocardium, of the ventricles, because of hypertension, coronary artery disease, valvular disease, that's not cardiomyopathy. Cardiomyopathy, the disease must be intrinsic to the muscle. It must. So hypertension, acute coronary disease, coronary artery disease, those are not intrinsic to the myocardium. So cardiomyopathies, they primarily affect the myocardium. That's what I want you guys to get. Cardiomyopathies, they affect the myocardium. These are diseases of the myocardium, right? Even though there have been people who wants to bring in diagnosis such as hypertensive cardiomyopathy, ischemic cardiomyopathy, they have been allowed to bring up those terminologies, but if we are strict in our definition of terms, cardiomyopathies are the primary disorders of the myocardium. Hypertension, coronary artery disease, valvular heart disease, and other diseases, pericardial disease, those are not intrinsic to the muscles. Those are not primary myocardial disorders. But eventually they can affect how the myocardium functions, but they're not primary disorders of the myocardium. So they are not cardiomyopathies. And cardiomyopathies have got are classified according to the changes that the disease is making to the myocardium. So there are cardiomyopathies. There are diseases of the myocardium that causes the ventricles to dilate. That's called dilated cardiomyopathy. Dilated cardiomyopathy. Some people write it DCMO. Some people just write it as DCM. Dilated cardiomyopathy. And then there's hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy, right? And then there is restrictive cardiomyopathy. Restrictive cardiomyopathy, right? Then we have, put it here. Then we have arrhythmogenic Then we have arrhythmogenic right ventricular cardiomyopathy. Right ventricular cardiomyopathy. And then we have unclassified cardiomyopathy, right? So when we talk about cardiomyopathy, these are the classifications: restrictive cardiomyopathy, hypertrophic cardiomyopathy. We are going to talk about this. Dilated cardiomyopathy, and these can only be diagnosed by an echo. Otherwise, these patients, they present more or less the same. Then you've got unclassified cardiomyopathy. Then you've got arrhythmogenic right ventricular cardiomyopathy. So these are the 5 types of cardiomyopathies.